My conversation today is with an African diaspora pediatric cardiac intensivist. She shares her experience of working in the USA and in Africa. Let's listen to the conversation. Hello, welcome back to the Chronicles of a Ghanaian Diaspora Nurse, the return. Thank you so much for tuning in once again. Today, I have a guest with me who is joining us all the way from the state of Washington, United States of America. So, Dr. Ndidi Musa is a pediatric cardiac intensivist at Seattle Children's Hospital and a fellow of the American College of Critical Care Medicine. She's a Christian, married with 3 adult children. Dr. Musa has worked extensively in training residents, fellows, and nurse practitioners in the care of the critically ill child, both in the US and resource limited countries. She has experience in teaching continuing medical education to physicians in Ghana, has worked with the Ghana College of Physicians and Surgeons. She's also mentored residents to become pediatric intensivists, which we'll probably talk about later as we go on in our conversation. And she's also sought opportunities to teach in different countries in Africa, which she will talk to us in detail about that. So, Dr. Ndidi Musa, you are welcome.
Thank you. Thank you for having me.
And thank you for spending your time. I know the time difference is wide, but you've made it. So thank you so much. Really appreciate that. So can you just tell us about how long you've been a doctor for?
Well, I've been a doctor for at least 37 years. I trained in Liberia at the A.M. Dogliotti College of Medicine. Yeah. That's where I met Barbara and Jojo. That you know Barbara. You interviewed Barbara.
Yeah,
she made the connection for me. I did pediatric first, and then I specialized in pediatric intensive care, and then I subspecialized in pediatric cardiac intensive care. So I generally work in the intensive care units, taking care of children who have had open heart surgery or who have cardiac disease that need either medical management or surgical palliation or treatment.
So can I ask, what made you choose this specialty of medicine? Just curious.
Well, growing up as a child, I used to see a pediatrician who was a lady, and I wanted to be like her. So that's what got me into pediatrics in the first place. And then whilst I was doing my pediatric training, we all have to go through the intensive care. I loved the fact that I could think on my feet. I could, make decisions and see them either improve the patient or the patient does poorly, and then I have to think again. So I love the physiology of taking care of children who are critically ill. The adrenaline rush that you have to make a life or death decision concerning. And then when you see them get better, working with them, seeing them leave the intensive care unit just gives me a great feeling of accomplishment. And so that's what actually led me into the field of critical care. And then I worked as an intensivist. I realized that I missed taking care of children with heart disease, and I loved it. So I went back and did a year of cardiac ICU in a children's hospital that had a surgical program, and then started working as a cardiac, helped build a program where I was initially, because they didn't have a specialized cardiac ICU. So I worked with a colleague of mine, and we built the program, and that's where my love just continued, to see kids with open heart, after open heart surgery, take care of them through to the end.
I can see the passion. I mean, you have reading through, your bio and what you've done. I'm saying, wow, you must have, love for the profession or for that field, to be able to accomplish all that you've accomplished so far. So, what would you say has been your best achievement in your whole medical career?
Well, I would say there are two things. Yeah. One is seeing my patient get better and go home. Mm-hmm. That's really the ultimate, that you help, you partner with the family, you partner with your colleagues, with trainees, with nurses at the bedside, with all the allied health professionals to help that patient get better and go home. That's the first one. The second one, passion of mine, or something that makes me feel like my work is worth it, is training the next generation to take my place. When I first started, I was young, I could do it, but as I've gotten older and realized that, what's my legacy, is these people that we have trained that will carry on the job to the next generation.
Yeah. Wow. Thank you for that. I just wanted you to just tell us, in terms of your field of specialty, pediatric intensivist, what's your view on in Africa, in that specialty in Africa in general? Do you think it's is it very common to find doctors in this field, or is it a resource that we are lacking, or we need to do more?
I would say we really need to do a lot more. Yeah. Because so many kids die unnecessarily from respiratory disorders, from dehydration, and shock, that if we were able to train physicians to recognize critically ill, there's a systematic way of doing things, which I have come to appreciate in the West. And I would love to, that's what actually led me to go out to change from mission-based to capacity building. Because if you teach them, the trade, how do I recognize a child who is in shock, and how do I start to resuscitate? We take all these resuscitation classes to help us think quickly on our feet. And these are not available in resource limited settings, nor are, equipment available, but there are simple things that can be done. Yeah. Because if you recognize it early, you can intervene and stop the cycle and improve the care of the child. I have a vivid memory. I took two of my residents to Kolebu Teaching Hospital, and I was rounding with them and the Ghanaian house staff, and we were talking about a patient who was cold. The legs were cold, the hands were cold. The kid was in shock, and they were saying, well, the mother isn't there to buy the fluids to give this child. But I remember that the consultant had told me that they all contribute every month, to a fund that allows them to have resources available. So I said, well, why don't we start the initial resuscitation, and then when the mother comes here, we can give her a prescription to replace and replenish the supplies. Yeah. And believe you me, they gave her the fluids and they touched her, and they could not imagine how warm she was, because they had taken care of the initial need that the child had. And that really taught all of us a lesson, that we can't wait. We need to intervene early. We can change the trajectory of that child's life by intervening early.
Wow, that's really, really key. So before we talk about, the work that you've done in Africa, what can I ask, what inspired you? I know obviously you come from Africa, Maybe you can tell a bit more about where you come from.
I have an interesting history because my father is Nigerian, my mother is Sierra Leonean, and they met in Ghana.
Wow.
And married in Ghana. So I tell people I'm a true West African.
Yes, yes, indeed. Indeed.
I've lived in both countries and I've visited Ghana a lot, so yes, so I call myself a West African because I have alliances on both sides of the family.
Yeah.
So the question you asked was, what do I
Inspired
do there?
You to give back.
What inspired to give back? Okay. Yeah. So after training in the US and doing a lot of work, to be an intensivist in America is a lot of work. I started, and the first time I went with my church on a mission, we went to Goma in the Democratic Republic of Congo. And I saw this baby who they were presenting this child to me, and I had not examined the child because at the time, I went there just as a professor to listen to their rounds. And as they started to talk, I realized that this child had a cardiac lesion. She was like 4 weeks old. And what they were describing to me sounded like she had a ventricular septal defect. And I had to ask myself, okay, if she was in the US, it would have been diagnosed and she would get the therapy that she needs. There in the Democratic Republic of Congo, there was no cardiologist that I could send her to. And I didn't even think if she needed surgery, she would get the surgery she needed. And I came to the reality that it wasn't fair for this child. Just because she was born in the Democratic Republic of Congo, why should she not have a life expectancy like a child born in the US? And that was what really led me to change my approach rather than go on medical missions to begin to build capacity. Because if you build the capacity, then no matter where the child is, they can get the care they need because you are training people to be able to operate on her and fix her VSD, which was not the case at the time. So I don't know. We sent the child to Rwanda, where there was a pediatric cardiologist, and I left, the country. So I never heard what happened to her. And I'm hoping that she did get an operation, or she, something good happened to her and her life expectancy. Because a VSD, you have a life expectancy to an adult when it's fixed. But if you don't have somebody to take care of you, then you start to get problems because it's not fixed early, and it's not intervened upon, and your life expectancy is shortened. So that was really what led me to change my focus from medical missions to building capacity in resource-limited settings.
Thank you for that. So currently, what projects are you involved in Africa?
Well, because of the coronavirus pandemic, it sort of put a damper on my travels because I used to travel a lot to teach pediatric fundamentals of critical care in various countries. And then I also used to go to Ghana with the Ghana College and the Ghana Foundation in America, physicians to teach. So all of that got put on hold. But, we are communicating today by Zoom, which is a good means of communicating with people in resource-limited settings because you can talk to them. We moved from using just the phone to being able to see each other by Zoom. So what I'm currently doing, I'm working with a group in Nigeria. They do cardiac surgery. And so I put together a physician group. So we have a cardiologist in Nigeria, the cardiothoracic surgeon, the pediatric cardiothoracic surgeon, the pediatric anesthesia, a couple of house staff. And then I combined a group from my institution, myself as a cardiac intensivist. We also have a retired pediatric cardiologist who has a wide spectrum of things. We also have a pediatric echo cardiologist who can read the echoes, help them build their program. And what was so nice was hearing them say that they have taken on harder cases because there's a breadth of discussion that occurs during that Zoom meeting. And they have seen their mortality go down and their morbidity go down. So in other words, kids are surviving, and they're doing complex surgeries that they would never have attempted if they hadn't had this breadth of discussion that we have every Monday morning. So that's where what I'm doing currently, because we haven't been given the green light to travel. So I hope next year that I will be able to travel and continue to build capacity as I travel.
Yeah, thank you so much. It's interesting, how the COVID, as bad as it sounds, it opened up opportunities for us to use technology to do things that we wouldn't even have thought of. Communicating with surgeons and nurses via Zoom and instructing them to perform procedures. That's really, really great. So I think you've mentioned something about the benefits of what you are doing already. I was going to ask you, what the impact. I think you've mentioned it. The feedback that they've given you shows that it's been helpful. Yeah.
And also, being able to inspire and encourage people to do what I do. Yeah. I have had 2 people from Ghana that I mentored. The first one who established a pediatric intensive care at Kumasi, at Kofuanoche, and the other one in Accra. These were people who had never seen a pediatric intensivist until I showed up during the Ghana College. I remember the first ICU session that I put together. The guy came up to me, I want to be a pediatric intensivist. And it's a joy, and it was a joy and honor to work with him, to present with him at the Ghana College Fiesta seminars. We did something together. And I said, listen, I don't even need to come back to Ghana because I've replaced myself. And
they can train others.
Yes, they're equally trained, they're well trained, they can present these cases, they can teach like myself. So it was really good. It was a great feeling to feel that, to know that I have been replaced. And, the legacy will continue, Same thing in Ethiopia, I trained 3 pediatric intensivists who are now finished. They're finished their fellowship. They're practicing in Ethiopia, which is great. And then I was involved in trying to establish a Pediatric Critical Care Fellowship in Kenya, which has also started. So we are training people, because really, to be honest with you, there's simple things that can be done, but you have to have the training to know what to do when you see a child who's critically ill. I mean, yes, it requires a lot of investment in resources, but again, you can start simple and save many, many lives. And that's what we're doing.
Wow, thank you so much. This is a typical example of brain circulation, the brain drain, and it's coming back, as they term it, brain circulation. Thank you so much for what you do. I just wanted to find out, did you face any challenges in terms of your work in Africa? What are some of the challenges that you faced?
Yes, I can tell you, all of us who have a heart for, in the diaspora, have a heart for working in Africa. We all get to Africa and we get challenged, challenged by the system, challenged by the resources, challenged by everything. But, you know, you look for the silver lining, you look for the opportunities. Where there are challenges, there are also opportunities to think innovatively and to do stuff. You know, I remember when I first went, you know, I'm not going to say where I went, but the people were like, what are you coming to do here? You know, here am I, an intensivist, you know, I have, I mean, a specialty that's not even available yet. And I paid my way and paid for myself to go
own money.
My own money. And they say, what are you coming here to tell us? You know, so, you know, it was, but you know what? God gave me wisdom. I shared with them the story of a surgeon who was from Guatemala. In fact, he died a year ago, but he trained in America from Guatemala, and he was the head surgeon at the best children's hospital at Boston Children's Hospital. He was the lead cardiothoracic surgeon, and he decided to start a program in Guatemala. So he brought two young guys that he trained as cardiothoracic surgeons, and he established a program in Guatemala to the point where they were able to report their results. They were doing equally well, like a program in the US. And I saw that as, you know, and when he retired, he went back to Guatemala and helped the program, and just recently transitioned. But it was a good example of somebody from a resource-limited country has accomplished so much in the West, yet going back to go and help build the capacity so that the kids in Guatemala could have the same resources, have the same opportunities, and live longer lives, because the cardiothoracic surgeon decided that, you know, he could train people to do the surgery there, rather than, because you can only bring a few to the US. You know, some people said, you know, bring the kids over, but that's just a few. Whereas if you train people to actually do the job, then you're reaching a lot more, you're saving a lot more than the number you can bring to the West.
That's very true. That's very true. So on that note, I would ask you, for what message do you have for the African diaspora, especially health professionals?
My message for my colleagues and in the diaspora: do not be discouraged. We can make a difference. Where there are challenges, there are opportunities. There's a possibility for innovation. So go back, do what you can, use Zoom, do what you can to teach, to train the next generation, because we need to. It's an imperative that we do, so that we can stop the unnecessary death that happens with our people. They can be saved. Children can be saved, even if they have heart disease. There are certain heart disease that can be operated on, when we can make an impact, if we're willing and able, if we're willing to put aside our differences, go back, do what we can. I'm not saying go back and live there if you don't want to live there, but you can give back, give back, give back, give back. People need us. They need our expertise. They need our experience, and we can collaborate. There's so many younger folks who are ready to collaborate. So go back and do something and make a difference in the life of people.
Thank you so much. I think you summed it up very, very well. Never give up, and you don't have to be there. And I'm just beginning to realize that there is a lot that people who haven't moved or relocated to Ghana, the amount of work that people are doing is really commendable. So thank you so much, Dr. Ndidi Musa, for spending your evening and sharing your experience with us. Thank you very much. It's been a pleasure.
Thank you, Rita. And I want to say I'm so grateful that you're doing this, because the more people hear about other people, the more they are challenged and stimulated to do something.
Yeah.
So thank you for giving me this opportunity to talk about what I do. I love what I do. I love the impact I'm making, and I love the legs to my legacy.